Hi, we're going to go over a demonstration of the Seldinger technique for central line placement. I'll be using a mannequin that has some Penrose drains in it to simulate a real vessel. I'm going to try my best to make this as realistic as possible. So wearing a cap and mask during our placement. Please adhere to your institution's SOPs for central line placement. Some places do require full sterile gowns as well. Most of the SOPs I've seen are usually cap, mask, and sterile gloves. So definitely adhere to your institution's SOPs. Another thing you should be doing is making sure you adhere to your practice act. Central line placement often includes a stab incision or an insertion hole to allow you to place the central line through a thicker skin. A facilitation hole, some people will call that. So please be aware that that could be prohibited by your practice act. So make sure that you are staying in line. So what I'm going to show you quickly is the equipment and the supplies we're going to be using. I'm using these Mila catheters here. I always laugh, I don't know if it's Mila or Mila, and I have a running joke with them all the time. They always call it a different name each time. So these are great little kits, and they are all inclusive, and they have everything we need to place the central line, almost everything. So what they don't include are the sterile gloves and a few other items that you may need. And I have here on a sterile field that I have created ahead of time some pre-made saline flushes, a 15 blade because I prefer 15 over 11s or 10s. There's a pair of suture scissors and a needle driver, it's actually Wilson Hager's there, and some gauze. So you want these all to be sterile. Nice to have a sterile field available to you because you may have to lay things on the sterile field in the middle of troubleshooting a catheter. So I have been experienced enough to be able to use my drape and my pack, meaning my little kit, as enough of a sterile field, but when you first start out, you may want a bigger sterile field. So don't feel ashamed to drape a larger Mayo stand to lay your equipment out and feel like you're more comfortable, because this is a sterile procedure and needs to be adhered as such. You want to have a little tape measure and measure your patient before you start. You want to be able to pick the proper size central line. In this particular patient, I've already pre-measured, but I'm going to bring it over to show you here. Goldie. So Goldie has a jugular that's just, this is the jugular on Goldie, and what we want to do is you want to measure from the insertion point to about where the entrance of the heart would be. And so for Goldie, roughly 13, let's see, I'd say about 13 centimeters, 14 centimeters. So if you're unsure, it's always better to go a little bit bigger than, like, longer than shorter, but I do like to try to be as accurate as possible because I don't want it to be too long. If it goes all the way into the atria, and it could irritate the atria, it shouldn't stay there, and you will see that on the post x-ray where we're going to check the placement of the catheter. I'm going to make sure that it's in the proper place. You could always back it out if it's too far in, but if it's too short, you can't do central line, you can't do central venous pressures if you don't get to the insertion point at the entrance of the heart, which is debatable if that's as valuable in today's medicine as it used to be. There's a lot of people who don't do CVPs anymore, so I tend to do my best to get as close as possible, and if it's a little short, not a big deal for me. If it's too long, you wind up with a lot of extra line outside the patient, and that can be more problematic when you're suturing the central line, because your insertion point may be more exposed and may cause more risk of bacteria to infiltrate and enter the vascular space. So it kind of comes with experience, so you're going to have to just measure in advance, do the best you can. I tell you, there's no trick that I could say that always measure properly. You just never know. You always have to do a 2-check X-ray to be sure that you're in the right place. So what I'm going to do is I'm just going to open the central line pack first and just review the equipment. And I'm going to glove up, I should say, and then start the process. And I'll redirect the camera so that it's just focused on the neck, so you'll only really see what I'm doing in the neck area. But understand that the equipment is right off to the side and you're maintaining sterile. So before I even glove up, I often will prepare myself, make sure everything is on my sterile field. I'll drop my blade, anything I need that I need to drop on a sterile field, I'll do before I glove up. I also want to clip and clean and shave the patient properly. So you want to have a very wide window. You don't want to have any fur get dragged in, especially at the end. If you do have extra line, you will have to find a way to curl that line and stay in the sterile field and suture it under a bandage. Keep it out of the fur. You don't want the fur touching the line in any way. So be liberal. I'm known to shave almost completely around the neck, but at least halfway from here all the way back is a good place to start, and as high as you think you can go behind the ear down. Everything anatomy-wise changes. It's often when you lay them down and you measure them when they're standing, and then you lay them down and things shift. So just be generous with your shaving. Scrub protocol, Chlorhex alcohol, follow institution guidelines for that. Most people do Chlorhex alcohol, and I like doing the 3 preps. And then we will open the Myla Central Line kit, and there will be a drape in there that we can use. So we're going to go ahead and show you what that looks like. So what I've done is I've just made sure that everything is all ready for me to grab. And in this kit is actually pretty much everything I need. And so what I'm going to do now is put my gloves on and start draping. So there's a little bit of shifting with the camera. Here goes my mask. Should have done that before opening that kit.